pediatric-onset MS, I think, does represent a unique opportunity to think about this prodromal phase. I mean, you could argue that they're an ideal group to study early signs of disease, such as MS. These individuals haven't lived for very long, and they have fewer potentially irrelevant life events and exposures relative to adults. And by exposures, I mean anything from different exercise regimes, diets, or medications, or accruing different comorbidities. So we will be presenting a late-breaking poster looking at rates of hospital and physician visits before onset of MS in our pediatric population. Again, this is a study spanning Canada and Sweden, and I think those findings are actually still under embargo till they will be presented later in the week at ECTRIMS. Our next big steps moving forward is to understand in more depth why these individuals who go on to develop MS, why they're accessing the health system more often than one would expect compared to matched general population controls, why they accessing the health system 10, 15 years before MS onset, and how does that differ in terms of an individual's age or sex, or perhaps even socioeconomic status. And those are some of the big key questions that we want to work on moving forwards. I guess really just thank my funding bodies and the studies that we're presenting, primarily being funded by the US National MS Society and MS Canada. And without those funding bodies, of course, we can't carry out these studies.